Welcome to today's class on Osteology of Norma frontalis. The entire aspect of the skull forms the facial skeleton or the splanchnicranium. The outline of Norma frontalis is oval in shape, which is wider above than below. It presents the forehead, pair of orbits, pair of malar eminences, anterior nasal aperture, upper jaw and lower jaw. The forehead part is formed by its commonest part of frontal bone, the colored part you can see here. So the frontal bone articulates with the pair of nasal bones on either side of the median plane, and it is attached to the pair of these nasal bones and frontal process of maxilla by frontonasal suture, and both the nasal bones are held together by internasal suture, and the point where this internasal suture meets the frontonasal suture is called as nasion. The point where internasal suture meets frontonasal suture is called as nasion, and just above the nasion you will have a median elevation between the two superciliary arches. That point is called as glabella. And laterally the frontal bone presents zygomatic process which articulates with the frontal process. This is the frontal process of zygoma to form the lateral margin of the orbit, and they are held by frontozygomatic suture here. And on either side of the median plane, the frontal bone presents a backward expansion to form the roof of the orbit. It forms the roof of the orbit along with the lesser wing of sphenoid, which is a part of roof posteriorly, whereas the most of the roof, major part of the roof is formed by the orbital plate of frontal bone that you can see here. These are the backward extensions of the frontal bone on either side of the median plane. And once you see the forehead here, it presents two frontal tubers which are prominent in children and females. So this is about the forehead part. Orbits. Orbits are the pair of bony cavities which contain eyeball, its vessels, its muscles, its nerves, and orbital pad of fat. So the orbit is a four-sided pyramidal cavity which has a apex which is directed backwards and medially, and a base which is formed by this orbital margin, and it presents four walls: roof, medial wall, lateral wall, and floor. So the apex of the orbit is directed backwards and medially, and here it presents a V-shaped orbital fissure. The upper part is called as superior orbital fissure, the lower part is called as inferior orbital fissure, and you can see the optic canal here through which optic nerve enters the orbit. So it's a bony cavity. It has an apex which is directed backwards and medially. The base is elliptical, formed mainly by three bones. One third of it is formed by frontal bone, one third of it is formed by zygomatic bone, and one third of it is formed by maxilla bone. Coming to the different walls of the orbit, the roof of the orbit is, as I already discussed in the forehead part. So you can see the roof of the orbit is formed by orbital plate of frontal bone and also by the lesser wing of sphenoid. The part where you are seeing the optic canal, this is the lesser wing of sphenoid. So two bones form the roof of the orbit: orbital plate of frontal bone and also part of lesser wing of sphenoid. The entire colored part is what you are appreciating is sphenoid, but the part which contains the optic canal, here it is lesser wing of sphenoid. Whereas the lateral wall of the orbit is formed by the zygomatic bone and the greater wing of sphenoid. Zygoma and greater wing of sphenoid. whereas the floor of the orbit is formed by maxilla, zygomatic bone, and also some part of palatine bone. If you take out the zygomatic bone and maxilla, some part of palatine bone also forms the floor of the orbit. It forms the floor of the orbit. So structures forming the floor of the orbit are zygoma, greater wing of sphenoid, and some part of the palatine bone, whereas the medial wall of the orbit is formed by frontal press of maxilla, lacrimal bone, part of ethmoid, and the body of sphenoid. 4 bones form the medial wall: maxillae, lacrimal, ethmoid, and body of sphenoid. Orbit has 4 margins: superior orbital margin, lateral orbital margin, inferior and medial orbital margin. When you observe the superior orbital margin, the medial 1/3 is blunt, whereas lateral 2/3 is sharp. And at the junction of medial 1/3 and lateral 2/3, you are seeing supraorbital foramina transmitting supraorbital nerve and vessels, whereas 1 finger width lateral to it, medial to it, here you are seeing a tubercle. Here you will see a tubercle or a process that is called as trochlea, and a nerve and vessels passing above it are called as supratrochlear nerve and vessel. So 1 finger width lateral to the glabella, you will see supratrochlear nerve and vessels. 1 finger width lateral to supratrochlear, you are seeing supraorbital nerve and vessels. Supratrochlear and supraorbital nerves are the frontal branch of ophthalmic division of trigeminal nerve, whereas supraorbital and supratrochlear arteries are branch of ophthalmic artery, which is a branch of internal carotid artery. And when you see the lateral margin is formed by frontal bone and zygomatic bone. Inferior orbital margin is formed by maxilla and zygoma, whereas medial orbital margin is ill-defined, formed by these bones: frontal, lacrimal and ethmoidal bones. That is the medial margin, and medial wall is thinnest among all the walls in the orbit. Medial wall is thinnest, whereas lateral wall is strongest.